Hi everybody, this is Yusuf Al-Aridi. I'm a massage therapist, and today what we are going to do treatment for the shoulder, back of the neck, for head and face. Those ones mainly is good for neck pain, headaches, migraine, sinuses, and shoulder tension. And the technique I'm going to use today, because since the client is gloves on, I will do my hands, of course, and using my palm, my thumb, and my fingers. Because I cannot use oil, because she's wearing her gloves. Everything we do is to get benefits and to let you learn and how you can do it and to feel more comfortable doing it at home. So we'll start today with the back of the neck and shoulder. I'm going to use as I said, my hand. I will do first a pressure point at the back of the neck here. This is called Medulla Oblongata. This is a very good gland here. It controls a lot of things in the body. So I'm going to press here about 3 times. We don't put too much pressure, just light to gentle pressure, because we don't want to cause any discomfort for the client. I did that 3 times, and then the back of the neck, I can use my thumb and my fingers, bring it to the side and down at the same time, down and up, down and up, down and up. So we'll do that also about 2-3 times. That reduce the tightness and the tension of the neck and help to increase the range of motion. People, they have tightness on this muscle. It will be so hard to put your head down and up. So loosening up those muscles, it helps to increase the movement of the neck and head. So after I did this, I do this area called Occipital Area. We do straight line. Do about 3 points. Again, we do that about 3 times. And after this, I can add some points like horizontally at the back of the head. Okay, now I'll warm up the shoulder. I use my palm pressure. I use it on one side first, like this at the edge of my hand, beside the spine. And the same thing on this side. We try not to do it on the spine, just beside it. Okay, like this. Okay. And now to the upper back and beside the shoulder. We massage it like this, circular movement. We do from the shoulder blade all the way to the base of the neck. I hope you can see the movement of my fingers, how that going on this area. Okay, now we lift this arm up. There is some points at the shoulder. This is a very good point for the shoulder. Usually this muscle called infraspinatus and this one supraspinatus. This is two muscles of the rotator cuff. I've seen a lot of people, they carry tension on those muscles. Also, we do it like the arm behind the back and beside the shoulder blade. See, this is the shoulder here. As muscles go between the spine and the shoulder, and one below. The one below this, it's another one of the rotator cuff muscles. We do some work on it. And on this muscle called rhomboid. If this muscle is so tight, it affects our breathing. Different techniques you can do here, like what I'm doing. I use your thumb, and we do the top of the shoulder, called supraspinatus muscle. You can use different technique, but the main thing is work on that muscle. Okay, we do the same thing on the side. Same thing on this one here. Okay, behind the back. Same thing for this muscle here. Underneath the shoulder blade. And the muscle between the spine and the shoulder. It's called rhomboid. And here we don't have only one layer. There are different layers of muscle, mainly 3 layers. The one called the trapezius, which is the top, cover the shoulder, from the top of the shoulder all the way, all this area. And there is the rotator cuff here, and there's the erector spinae muscle, the one they go from the base of the neck to the lower back, and the deep one is called the rhomboid, which is right in here. Okay. Again, we massage this area. You can put your arm up this way. And we can massage this area with So we work on all this area. We reduce the whole tightness, so there is some tension there, and we increase the blood flow, so it's carry more oxygen. All the tissues and the cells will be more healthy. Okay. Now we are going to do work on the head and face. I want the client to go on your back. Okay. What I will do is some points here first to the shoulder. There is this area between the shoulder joint and the ribs. There is some points. I like to work on them, because there is a lot of tendons coming from to this area. We'll do the other one. You bend this so we bend the elbow so we can expose the muscle. Okay. Now we are going to do head and face, which is really good for anxiety, for stress, for headache, for migraine, for sinuses, and for relaxation as well. We go 1 point at the middle of the back, at the head, at the top, the middle of the head, there's a point. We hold it for about 5 seconds. We do that 3 times. And at the top of the head, we go lines here, horizontal lines. We do a straight line from the middle to the front. Okay, in this area of the head, there's a lot of blood vessels. So in this area of the head, 20% of the whole blood in this area, and the 80% the rest of the body. So there is a lot of blood vessels in the head. Now there is a point here. I like to work and hold it. Okay, so you work on the head. Now I work straight line on the forehead. I mean horizontal line. Okay, and now there's points at the top in this area. They are a little tender usually. I will press on this one and I hold it. Okay, this is called Supraorbital Area, which is above the eye. We go a line like this, about 3 points, and the one below called infraorbital, like this. So these areas, we do it about 3 or 4 times, and then we do these 2 fingers, this finger and the middle finger on top of it, so we can help it to move it. We can put it in this area and push it down like this. This is good for sinuses as well. And there is a big bone here, the cheek. We can do 3 fingers and push it up a little bit. Okay. There is this area, we call it temporal area. Okay, there's a point at the middle of the ear. So I find it's like here. If I ask the client to open the mouth, you feel it like a hole. Open your mouth. Okay, and you press on this. This is good also for ear problem, vertigo, dizziness, and for TMJ. So we do the other side. Okay, open your mouth. Open again. Okay. And we massage the temple area with our fingers like this. And the face, we grab it slowly, gently, like this. Okay, that's about it. I hope you get some benefit from this session, and you can try it at home. It's safe, and we are willing to help anytime. You need a question, you can ask any question. We'll be more than happy to help you. Thank you and have a great day. God bless you.